Hi, Dr. Corinne Knight here from Advantage Physical Therapy, and this is Jim. We're going to talk a little bit about low back pain or sacroiliac pain from running, and I'm going to give you just a couple stretches to help with that, a little bit of a strengthening exercise, and then I'd like to talk to you about some anti-inflammatories. So our first stretch we're going to do is called a piriformis stretch. And go ahead and show them that for us, Jim. Thank you. And so the piriformis is a small muscle that's in your derriere, and it crosses right over that SI joint. So what you do in sitting is you are going to take the leg you want to stretch, so Jim's using his left, and you're going to cross it over like you're putting on a sock. And then you're just going to lean forward, and you should be able to feel that stretch. If you don't feel a stretch, really try and get your body weight as forward as possible, and you will. I recommend to all my patients, you want to hold a stretch for about 30 seconds and do it 3 times. But for sake of a short video, we're just going to kind of show them to you today. The next stretch you want to do, I call it a pretzel stretch, and you can follow right into it after your piriformis stretch. Jim's going to do the best he can with this one, and it's going to help rotate and loosen up that spine. You just keep the piriformis position. You take your right hand, if you're stretching your left one, cross it over your knee, and then grab the back of the chair, and you get that rotation going. Once again, holding it for 30 seconds and doing it 3 times. And of course, you always want to do both sides. You want to stay even. Now to talk a little bit about a stretching or self-mobilization technique. We call it roll for control here at Advantage, and it's just going to utilize your pelvic muscles just to strengthen, your hips to strengthen. You're going to start by putting your hands on the side of your knees. Okay, you're going to sit up nice and tall, and you're just going to push your knees using your hip muscles out gently into your hands. You're going to hold it for 10 seconds, and then after that you're going to bring your hands together in the center on the inside of your knees, and you're going to squeeze tight. Sometimes you get a pop with this, but like I said, your goal is to really feel like you're mobilizing those hips and utilizing those muscles. Roll for control. We recommend performing it a total of 10 times, holding it 10 seconds each time. And last but not least, I want to reiterate with ibuprofen. Like I said, I'm a huge fan of ibuprofen. I think it's a great way for anti-inflammatory techniques. Of course, if your doctor says otherwise, or if you have any gastrointestinal issues with it, do not take it. Comply with the bottle, 2 to 4 every 4 to 6 hours. But really, take it regularly to get it systemically in your body, especially if you know you're going to be doing some type of activity that causes inflammation. Thank you very much.